What's going on, everyone? Happy Thursday to everyone, and welcome to the Thursday edition of the Pandemic Update for Thursday, June 22nd, 2023. Hopefully everyone's staying safe and healthy. Hopefully you had a good day today, and if you had to take a COVID test, I hope you tested negative. Starting off with India today, India recorded another 95 cases, and their death toll is at 531,900. We know both of these numbers are likely underdone because India does have 1 billion people. Now moving back here to the United States, we got some news out of Ohio today. Ohio has done something that has not happened since May, and that is their numbers have gone up for the first time since May. Their case numbers, that is. And they reported 1,301 new cases this week versus 1,228 cases last week. And it does say here, despite that, their hospitalizations have dropped. They were 161 last week and just 101 hospitalized this week. So while their cases have gone up slightly, it is good to see that their hospitalizations are down, but I highly stress, we don't know if that's an accurate hospitalization number or not because not all hospitals are testing for COVID. Sometimes you go to the ER and they're not testing you. I think a lot are still testing if a person is admitted, but again, you know what? We don't know if that's true at all hospitals, so that number could be flawed for all we know at this point in time. Now we're going to do a couple things on long COVID. If you're new to my channel, or if this is the first time you've seen one of my pandemic updates, maybe you don't know what long COVID is. Obviously, everyone knows what COVID is at this point, but maybe some don't know what long COVID is. And basically what long COVID is basically you test positive for COVID, right? And in many cases, you do recover. But in some cases, people do not recover, and they stay sick beyond 14 days. They have lingering symptoms. They have new symptoms that pop up. They have post-COVID conditions. There's 150 to 200 different possible symptoms of long COVID, and it just persists for a long period of time. Some people do eventually recover. Some don't recover. I personally know people who have not recovered from long COVID, and yes, me personally, I have dealt with long COVID. I had a suspected case of COVID back at the beginning of the pandemic, before it was declared a pandemic in early 2020. I had all the cases. I somewhat got better, and then you know what ended up happening? A lot of my symptoms came back again, and, well, now I've developed asthma as a result, which is something I did not have before COVID. So you get where I'm coming from? You get new health issues that stem from coronavirus infections, and that's long COVID. There's many different ways you can describe long COVID. That's just one of them. Well, this graphic shows, this is from the Centers for Disease Control, CDC, approximately 1 in 5 adults aged 18 plus have a health condition that might be related to their previous COVID-19 illness, such as neurological and mental health conditions, cardiovascular conditions, kidney failure, respiratory conditions, blood clots, and vascular issues. I mean, it goes on. There's a lot of different things. And it says here, talk to your healthcare provider if you have symptoms after COVID-19. Personally, that's something I did with my previous doctor, and, well, they didn't listen to me too well, so I switched to another doctor. He listened to me very well, and I've seen several specialists as a result, and voila, that's how I found out that I have asthma now. So, yes, if you're experiencing any post-COVID symptoms, please call your doctor. Have it looked into. Get some testing done. Find out what's going on. They are there to help you and, well, hopefully listen. Find a doctor that listens. If your doctor's not listening to you about problems you're having post-COVID, might be a good idea to find another doctor. That's what I did, and I am so glad I did that. Continuing with the long COVID theme, I did a poll last night. I'll read the whole tweet. Time for a poll. Do you currently know someone who has long COVID? If that person is yourself, that counts as a yes. I wanted to raise more awareness how serious this life-changing virus is, and boy did we do that. So we had 1,264 votes. That's quite a few votes. Consider I have over 18,500 some followers. Don't care about that. The point is 1,264 people voted. Out of that, 80.1% said yes. 19.9% said no. And that 80% number, there's still an hour left to vote, 46 minutes left. That 80% number has been going up. That was just 20% a couple minutes ago before I started this recording. And the point being made is a heck of a lot of people know someone who has long COVID or they have long COVID. That's telling me we need to do more in educating people the risk of catching a COVID infection. And maybe it's time I do another video down the line. Maybe we'll do a second video Saturday. You know how sometimes Saturday we do an editorial piece or we do something, we do the early edition of the pandemic update on Saturdays and then we do something again in the evening. I think that may be needed this week. It may be needed where I talk about the risk of getting a COVID infection and why it is so important to have risk management in your life and choose what you do in your life wisely. One COVID infection, just one COVID infection, can completely change or even destroy your life and make your day-to-day activities so much harder to do or even change what you have to do. Some people have had to sell their house. Some people have had to quit their jobs. I mean, it's really bad what's going on. And there's been a whole slew of comments here. We're not going to read any of the comments, but if you want to chime into this, feel free. My Twitter is at COVID Data Report. Go ahead, read the comments. These are real stories, folks. Yes, long COVID is a real thing, and it needs to be dealt with. Walgreens did update this week. The national positivity was 24.8%. Prior week was 22.8%. A difference of 2%. Total test, 1,961. Prior week, 2,286. And we're not going to take a look at any more states today. I don't think that's necessary. I do want to show this. Remember last week, the Northeast was starting to rise? Well, we got a BioBot analytics update today. Now the Northeast is dropping. I think what we're seeing with wastewater here is, though the overall trend is down, I think we're bouncing off the bottom. I mean, how long is it going to keep going down? I don't know. This is just really fascinating that it continues to drop. I've seen some people say, is wastewater incorrect? Can't say that, but the one thing I can tell you is it's really surprising that it continues to drop, because all the other years of the pandemic, we did see COVID rise as we entered into the summertime. So, hey, take the good news when we can get it. No update yet to the CDC COVID wastewater site map. That will update on Friday. I'm going to move myself to the left, though, because we will read these numbers. Number of sites, 131. That's number of new sites. 0 to 19% COVID detected is at 729 sites. 20 to 39% COVID detected is at 350 sites. 40 to 59% is at 105 sites. 60 to 79% is at 23 sites. And only 4 sites are in the red, which would be 80 to 100%. One of them is in New York State, or 2 of them are in New York State. There's also one out in the West and a couple other places. There's 4 total. Looks like maybe that red site did change, because I don't recall. Let's take a look at this. I don't recall seeing a Wyoming wastewater site in the red, and wow, this site is rapidly going up. Sheridan County, with 20,000 population at this sewer shed, it is rapidly going up, and I think I found the other one. It's now in North Carolina. So while there was a slight change, the overall number of these sites did not change. So that's interesting to see. Just notice that while we are recording here. Taking a look at the CDC variant proportion. Last day of these old numbers. Hopefully we get the scheduled update from the CDC tomorrow. XBB 1.5 is at 39%. XBB 116 is at 18.2%. And XBB 191 is at 12.5%. We expect to see XBB 116 higher tomorrow. The wild card for tomorrow is, will the FU variant make an appearance? I'm not going to say yes or no, but at some point it probably will. Will it be tomorrow? You'll have to wait and find out. And that variant proportion update will be out early tomorrow afternoon. I've been refreshing this all day long. And let's see. Okay, finally we got an update on this. I guess it just came in. Because this is for the hospitalization ER visits, and Interesting update here. So it's finally in. Alaska, we are seeing ER visits slightly go up. It says here substantial increase. That's in the orange. We are also seeing Michigan go up with a moderate increase. We're seeing Kentucky have a moderate increase. We are seeing West Virginia have a moderate increase. And we are seeing Maryland with a substantial increase now. So we do have some places that are starting to rise. The rest of the country, as you can see in the yellow, is stable. The greens and the darker green, that is decreasing or, significantly decreasing. All right, moving on to this day in COVID history, we do have one thing today. June 22nd of 2020, the journal Science Translational Medicine releases a study suggesting that as many as 80% of Americans who sought care for flu-like illness in March 2020 were likely infected with undetected COVID-19. That's this day in COVID history. Let's do 3 wastewater sites today, shall we? And when I say 3 wastewater sites, these are ones that show multiple different viruses. Moving myself to the left again. Portland, Maine. Portland, Maine is showing low levels of COVID at this time. Influenza, they did have a little spike of influenza entering June, and now that has dropped off. RSV not detected, HMV not detected, no cases of monkeypox, and norovirus is at a concerning level here. You can see based on the values on the left, that's higher than we are seeing in other states, so that is relatively concerning. If anything, it's flat to even slightly trying to rise, so that's interesting. They are having a norovirus issue up in Portland, Maine. Let's come down here to my state, Pennsylvania. What's going on in the Harrisburg metro area? Harrisburg, COVID wastewater is slightly starting to rise. Influenza is not detected. RSV not detected. HMV not being really detected. Monkeypox, none detected here. And norovirus is lower than Maine. However, it is showing slight signs of starting to rise. And let's do one more wastewater site in the country. How about we come down to, I don't know, what's going on in the Las Vegas area? There should be an interesting one. COVID is dropping. Influenza, not an issue. RSV, not an issue. HMV, not an issue. Monkeypox, look at that, non-detected. And norovirus is dropping. You can see here. Remember the first site we showed you, Maine? Look how much lower Las Vegas is. So yeah, that first site we showed you in Maine, that's concerning for norovirus, and oftentimes norovirus can be found in cruise ships, nursing homes. I don't think wastewater wouldn't pick up cruise ships, but nursing home outbreaks, that is a real problem, and that's something that should be dealt with because it can be bad. All right, moving myself back to the right, and we do have something of concern here. New Jersey, 9 hospitals did not report today. 61 out of 70, so this dropped to 160. Potentially one of the bigger hospitals maybe did not report in New Jersey today. 7 people are on a ventilator and 16 people in the ICU. Moving on to Philadelphia. This is not good. I don't like this number. 904 ambulance calls, EMS incidents in Philadelphia County yesterday. That's super high. That's above my 800 threshold. That's all the way up above 900. That's not good. I don't like seeing it that high. Something is going on. I mean, we have been at elevated levels. We haven't dropped below 700 in a while. I mean, normally we would get a few days that drop below 700. That hasn't happened. We'll see what tomorrow's number is. Taking a live look at Montgomery County. Not too bad. That's a suburban county of Philadelphia. And Chester County is not doing terrible right now as well. Now we come over to this, New York State. I don't like this. New York State. So when I show you the cases here, it doesn't show you the at-home testing or the reinfections. These are, I guess, the first-time infections. And look at this. 862 new cases today. That's highest we've seen in a while. Positivity has gone up, 4.5%. And 3.9% is the 7-day average. But remember, that 24-hour average, that's not good to see. So again, I mean, we're seeing the wastewater come down in the Northeast. You saw the biometrics. I'll show it to you again. There's the Northeast in the golden color. It's dropping, but it's such a mixed signal. It really varies from state to state. New York State, positivity up, cases up. So that's not good to see. And who knows how many reinfections or people who didn't get tested, or the at-home test are being reported. But the good thing is, New York hospitalizations are not rising. The latest update shows 478 people hospitalized and 40 people in the ICU. New York City for today, I'll show you that. New York City for today relatively remained the same. Let's zoom this in, and you can see it's pretty much flat. Just ever so slight drop today in New York City hospitalizations. Alrighty, let's take a look at the international update. I'll refresh this in case there were any updates since I last refreshed it earlier. Around the world, 43% decrease in cases. Weekly deaths are down 45%. Brazil, cases are up 3%. Deaths are up 97%. I promised you I would do some research and find out what's going on there. I did some research. I found no new news stories. Really finding nothing. Don't know what's going on there. Maybe someone can tweet something on Twitter to give us a clue. It'd be nice to know why their deaths are going up so much. I mean, I get it. It's wintertime there. They're seeing their surge now, but you know what? Seems a little odd that it's such a big increase. Spain cases are down 71%. Deaths are down 70%. That's good to see. Bolivia cases up 39%. Deaths, none reported this week. One was reported last week. Mexico is reporting 18% decrease in cases, and they also did report one death this week versus 0 last week. Bangladesh, 22% increase in cases, and 5 deaths versus 1 death last week. And we will end today on Romania, where there is a 24% decrease in cases and a 71% decrease in deaths. If you want to follow me on Twitter, my Twitter account is at COVID Data Report. I always love it when you guys bring stuff to my attention, such as news I don't see, maybe cases somewhere, anything that needs to be brought to my attention. Or if you want to follow what I tweet out, that's the best way to stay on top of what I tweet. I tweet things at any time of the day. I've even tweeted things out 3, 4 o'clock in the morning. You know, if I can't sleep at night, I say, what's going on with Twitter? I find something, tweet about it. So if you want to stay up to date with what I'm covering, or what I'm reporting on or tweeting on, follow me on Twitter. Again, that is at COVID Data Report. Alrighty, guys. Thanks for watching this pandemic update. If you enjoyed this pandemic update, give it a thumbs up. If you want to see this or anything else I do on my channel, such as tomorrow's variant proportion update, which will come once the CDC updates, hit that subscribe button down below. I will see you all again next time. But until I see you again next time, stay safe, everyone, and have a great evening.